What's the cause of my sunken eyes and under eye bags? Hi, I am 35 and lately I have noticed that my eyes have sunk in more and I have under eye bags. Is it possible that hyperthyroid is the issue, and is it reversible?
Thank you for your question. You've asked what is the cause of the appearance of your eyes, and you submitted some photos that helps give us perspective on what your concerns are, and you're asking about a possibility of thyroid-related issues. You're 35 years old, and what I would ask of you is to review some photos of yourself from 5 years ago, from 10 years ago. A few years ago, I wrote a book called The Fine Art of Looking Younger. And to conceptually communicate some key elements of what is important to understand when you consider cosmetic procedures. And our practice has a very strong focus on facial aging. So with facial aging, there are two things that happen. There's volume loss and there is descent or sagging. Well, volume loss is a very big factor. So what you're noticing as, quote, hollowing, statistically is likely to be related to facial aging. But if you have any cause to be concerned, speak to your medical doctor, your internist, and have them do hormonal levels. Thyroid hormones is basically standard testing for any general medical workup. But looking at how things have changed, what most people experience who come for the attention of a practice like mine is they'll have volume loss in the eyelid-to-cheek area or the submalar area, as well as a little bit of lower eyelid fat prolapse, where there's a bag pushing forward. So interestingly, when a person has a bag pushing forward, very often they'll consider it as their face being hollow because the valley next to the eye bag is deep, and so they see the hollowing without seeing how it relates to the puffiness. With the photos you submitted, it appears that you do have some lower eyelid puffiness. So I'll explain a little bit of what that is. Lower eyelid puffiness that is constant is typically referred to as lower eyelid fat prolapse. Paradoxically, while you have volume loss of fat in other areas, we lose bone, muscle, fat, soft tissue. Around the eyes, genetically, you can have a forward movement of fat that's normally in the orbital space, pushes forward. The orbital space is the space around the eye, pushes forward and creates a hernia. So typically for lower eyelid fat prolapse, we would address this with the most common procedure, which we do in our practice, is called transconjunctival lower eyelid blepharoplasty. Now that's a mouthful. It means basically we go from the inside of the eyelid and sculpt the eyelid fat so that you don't look like you have the bulges under your eye. At the same time, we also inform our patients to be mindful of the relative volume loss in the eyelid and cheek junction so that we can strategize volume correction as is appropriate based on the patient's own aesthetic, not our aesthetic, but their aesthetic. They feel that they still feel like there's some volume loss, even though they improved the bagginess under the eyes, then we'll address that. We'll use Restylane or a hyaluronic acid filler. We'll use platelet-rich plasma, which is a product derived from your own blood. It is using the healing and growth factors from the cells called platelets and the plasma that is separated from the red blood cells to stimulate collagen blood supply. And that's part of a youthful appearance, is having vibrant skin that has some substance to it. That's where the volume loss is so critically important. So that being said, I think that it is best for you, besides seeing your medical doctor, to rule out any other metabolic issues. Meet with qualified, experienced cosmetic surgeons, and I say surgeons as opposed to non-surgeons because surgeons can do both non-surgical and surgical procedures, and learn about your options for rejuvenation in the eye area. I think you'll be fascinated to learn there are a lot of different options, and it'll be up to you to decide which doctor you resonate with and it makes sense in terms of a plan. So I would suggest you do meet with a few and get a sense of what you're comfortable with and which doctor you feel will address the type of issue that's primarily the highest priority in your mind. So I hope that was helpful. I wish you the best of luck. Thank you for your question.